Well, I'm back fresh from my rheumatology appointment with a whole lot of information to unpack. So I thought I would bring my pink planner, which made an appearance with me at my appointments this week and has kept me on track and helped me to organise my thoughts, and go through with you what's happened, the updates and what's happening next, because there's rather a lot going on. I am, of course, armed with a cup of tea, absolutely essential, and there was a biscuit in there somewhere. So I went into my appointments armed with information. So far this week I've had one appointment for cardiology, and then the second appointment I've had was for rheumatology, which was my massive appointment where there was a huge emphasis needing to be put on coordination of care, and this follows the complaint that I've had to put into PALS and the request for help that I've asked for from my MP, which ended up going to the CEO of the hospital. So there's been a lot going on, and if you've missed out on that, make sure you go back and see some of my previous videos as I've broken down what's happened as it's happened to try and keep on track, because there's been so many things going on it would be easy for me to completely lose focus of where we are. So I went into the appointments both with a piece of paper outlining currently where I am at. I appreciate this is very small font. I wanted it to be an at a glance of all of the ongoing problems and issues that I've been having, what I thought I might need in terms of treatment, and any questions that I sort of had that were massive to the help that I'd requested. These sheets were so useful, so I definitely recommend, if you're in a similar position where you've got a lot to say and you're worried you're going to forget something, to put together like a cheat sheet, hand it to the consultants and let them keep hold of it, as it provides them with a visual reference throughout the appointments, and I'm so pleased that I did this. Along with those cheat sheets, I also took in some questions which I had in my handy planner. I had a pen and I could keep note of what was going on, and that also helped me to get the answers that I needed. So with all of that being said, let's go through a brief overview of what's happened and what's happening next. Let's start with cardiology. Cardiology I had never seen before. I have always wondered if I should be reviewed for cardiology because I've had quite a lot of heart related symptoms for a while, but this is the first time I've ever actually seen a consultant, and I have to say they were absolutely lovely. They really listened to me and they've really validated some of the things that I've been going through. The overall consensus at the moment with my heart is that fundamentally we don't think there's anything specifically wrong with my heart, which is great news. We think that it's reacting to everything that's happened over the last year. Having had sepsis in March of last year, followed by my surgery, followed by the horrendous arthritis symptoms, the inflammation, etc., it's no wonder my heart is struggling, and on the day-to-day I'm getting dizziness, heart palpitations, shortness of breath, etc. They think that this will improve as my medication changes and as my prednisone tapers, and obviously at the moment with Cushing's syndrome, which I'm experiencing extremely badly, that's putting a lot of strain on my heart. So the overall feeling is there's probably not much going on, but it's worth keeping an eye on it, and the hope is that it's going to start to become more manageable as we go forward, but it's something to keep an eye on. Having said all of this, given the amount of information I have everywhere, and I'm talking my eyes, my joints, my GI tract, everything, they are going to do a heart MRI, which I'm quite pleased about. I would rather have a baseline check and know that there was nothing sinister going on than not have something done and miss something. So I've got to have an MRI in the next few weeks. It's going to be with contrast, hopefully, if they can get venous access, and that's going to be to check for inflammation around my heart muscle. So that's coming up on the horizon. Alongside this, neurology have been looking into me. I went for a brain MRI a few days ago, and they're checking me for demyelination syndromes as well as different things that could be triggered by my inflammation. So they're giving me a once over as well, and I'm waiting for the results of that MRI. But it has been noted that I have what's known as a benign tremor. So I tremor, shake and make kind of involuntary movements all the time. And to try and get a grip of that and to help me with that, they've suggested propranolol, but I wasn't allowed to be prescribed propranolol until cardiology had checked that that was okay, because there was some concern over whether my heart would tolerate it, what would happen with my blood pressure, and also what would happen if I did get one of my spontaneous allergic reactions, if the propranolol would put too much strain on my heart. However, cardiology have confirmed that they are happy for me to go on it, at least until we get to the other side of the steroids and we've come off of them, and see how I get on and if it helps. And if it does, it could be something that I stay on long term, or equally it might not work for me. So that one's going to be a trial. I should be starting that next week, and we'll see how we get on. I don't really know anybody else on propranolol, so if you have any stories of how it's gone or how you found it, I would love to hear. I also mentioned to cardiology about my venous access and about pain management, because both of those things somewhat tie into cardiology's treatment. Being able to have the contrast at the MRI is going to depend on the quality of my veins, and equally if I'm in a lot of pain, that's putting strain on my heart. So they are in conversation with the other departments about that. They couldn't directly do anything to assist, but they've acknowledged that it is a problem. So that then swings us on to the rheumatology appointment, which is where a lot of bigger decisions were made, and that one's the one that I've had today. So the key bit of information is I'm starting a new biologic. We knew I was going to have to following my infliximab reaction, but we weren't sure which one. So I'm being put onto Adalimumab, or Humira. People know it by different names. This is a multifunctional drug. I've been told that it's known to help with IBD, with uveitis, aka inflammation in my eyes, and also with enteropathic arthritis. So it seems to be quite a hard hitter, and it should help with all of the symptoms that I have as a whole. So what's been agreed is I'm going to have that via an injection. So I have to be taught how to give the injections, but I did that before last year with methotrexate. And given my weird and wonderful reactions that don't seem to come on the first time I have it, but tend to come on in the second or the third time, they're going to let me do the first 3 injections at the hospital so that I'm under supervision. So I'm really relieved about that, because it does make me nervous. They're also going to administer some allergy medication before, which they've already given to me, so I can take it in the morning before I have the injection and then travel to the hospital, and it will be working by the time I get there. And I believe that's called fexofenadine, to see how I get on with it and to see if that helps to quell some of the responses that I'm having. But they are also going to have a conversation with allergy and immunology about my allergies moving forward and how we deal with those, especially surrounding tapering of the prednisone, as that suppresses a lot of the allergies that I have. And so it's not only suppressing my ability to get a diagnosis for something like MCAS, but it's also suppressing the responses that I'm having. And then when I do come off of the prednisone, I start to get a lot worse reactions, and it's to things I'm sometimes not even aware of. So that's going to be interesting for a few months until that levels out. The plan is that I'm going to have 2 doses of the adalimumab, and assuming everything goes well, I'm then allowed to start tapering the prednisone. Adalimumab has a loading time of between 2 and 12 weeks, so it's not going to be instant that I see results, but the hope is that it will start to kick in and I will be able to taper the pred. I feel like I've gone through this cycle so many times, and I always get to that point and it doesn't work. So I can't lie, I'm not holding my breath. However, I'm really, really hopeful that this is going to be the drug that works, and wouldn't it be great if it did? And hopefully I will then be able to taper, and that will also take control of the Cushing syndrome that I've developed and help me to just level back out again and get my cortisol levels back to where they should be, because my body is not coping well at the moment. Rheumatology have taken it upon themselves to be sort of the middleman and organise everyone, which I'm really relieved about, because to be honest, that makes the most sense in all of this. Rheumatology are leading the plan. The other departments just need to be aware of it and need to loop in and tie in here and there, but they're taking it upon themselves to email everybody and to notify everybody, and I've really stressed that that needs to happen, because at the end of the day it's enough work being the sick person, let alone trying to coordinate everybody else. So during this time, I'm obviously not going to need the IV access because I'm going to be having the injections. So that's going to overcome the problems that I was having with the venous access for the moment, and going to mean that I don't need the PICC line. So that's kind of good news, because that was a whole other route of treatment that I was going to have to go down. So the only thing that will really be outstanding is having regular blood tests, which you have to have with the biologics. I've got my first blood form so that I'm ready for that, but we're going to try and leave as much of a gap in between each of the bloods as we can to allow my veins to recover as much as possible, albeit they are very scarred and damaged, and veins don't heal up. So it is one of those things that is going to be an ongoing issue, but hopefully we're going to be able to use different points for my injection, spread things out a bit more, and that should help to just overall slow down the degradation of my veins. I also mentioned about my osteopenia and the DEXA scans and the whole situation with my bones, which I learned earlier in the year had become more of a problem, and I stressed that I am young and I don't want to develop osteoporosis if I can avoid it, and I also don't want things to go unnoticed. So the consultant in rheumatology agreed with me that I should be on calcium and vitamin D, but we need to look at how I can actually tolerate having those, because with having an ileostomy, I find that I don't absorb things as well as other people. B12 I don't absorb at all, so that's another one that's an outstanding that I've got to try and work on a better way of being able to take that. But injections of things don't typically go down well in my body, so we're working with pharmacy to find a way around it, maybe find a supplement that can digest quickly and isn't enteric coated, or look at perhaps under the tongue sprays or something like that. So that's still to be confirmed, but they're going to talk to pharmacy about my options regards calcium, vitamin D, and then B12 will be something I've got to talk to my IBD team about. I did bring up the subject of pain management because, again, cardiology have made it very clear that my heart is likely in distress over the pain that I'm in, and that's not helping anything. And obviously, being a HEDS sufferer, I dislocate all the time, so I'm in a lot of pain a lot of the time, and it's not something that anyone's ever really helped me to deal with or manage. Equally, I have access to pain medication, which I'm very grateful for, but I worry about taking it too much in case I'm damaging my GI tract further. And after having such severe GI symptoms with my ulcerative colitis, I will admit I am nervous to take something and make anything any worse or flare anything up. So I'm hoping that I can get some guidance on that. Rheumatology weren't very keen to help me, but I'm hoping I can go via my GP and find out some more information. But they have upgraded my physiotherapy referral to be urgent, which is excellent because it was a routine referral, which meant I would be seen towards the end of the summer, which is quite a long time to wait. I've been on the list since last autumn, whereas with an urgent one, I should be seen within a few weeks. And my hope is that they're going to be able to help me to get some braces to hold my joints in so that at least I'm minimising pain by not dislocating more than I have to. Overall, the outcome of the appointment is that they're not going to arrange an MDT, multidisciplinary team meeting. There was some talk about me being seen in a joint clinic, so that would be between rheumatology and IBD, but when the consultant looked on the computer during my appointment, it turns out that that has actually been cancelled, so she's not entirely sure why it's been cancelled, and we're not entirely sure of the situation, but she's promised she's going to look into it and update me within the next couple of days. But the feeling is that an MDT isn't needed because the rheumatologist herself can do a lot of the organising and notifying of everybody involved. The only thing that's outstanding really in terms of appointments is getting hold of allergy/immunology and getting them to have a conversation with me about mast cell activation syndrome, getting the testing redone once I'm off the prednisone, and moving forward with a better allergy management plan. But that's something that's going to come down the line because at the moment it's so chicken and egg and I can't be tested for one thing until another thing's happened. I need to get off the prednisone in order for us to see a true level of where I'm at with a lot of different things. Otherwise, we're just treating the symptoms rather than the core problems. I have to say the consultant and the nurse who sat in on the appointment were really conscientious and did make me feel like I've been listened to following all of the saga with what's happened with me having to get attention on this. And they did listen to the fact that I said to them that I wasn't directly aiming any of my comments at them, but the department is extremely dysfunctional and I've had to do what I've had to do because I'm being left in a terrible health state. So they were very good about that. One of the things I brought up in my complaint was the fact that I had no way of contacting the department that wasn't via phone call, which I find really difficult because of my hearing problems, and they were conscientious enough to even provide me with an email address. So I now have that to be able to contact the nurses should I need them. So overall, I was really impressed, really happy that I felt like I'd been listened to, and I think that they were hearing what I was saying. We're never going to be able to fix some of the wider issues in the NHS, and my goodness, there are some big ones. But I felt like they did everything they reasonably could within their powers to help me in my situation, and it sounds like they've taken on board some of the feedback that I've given, so hopefully a situation like this doesn't occur for another patient in the future. It's ridiculous, but even just explaining this and going through it is making me out of breath. This Cushing's syndrome is no joke. So yeah, I appreciate it was a very long update and there was a lot to unpack. I feel like my brain is just rolling around, but it was a very productive start to the week. I think we are moving in general in the right direction. I still have my reservations, I still have my concerns about things, but we've got to move ahead, we've got to try a different biologic, and we've got to get off the prednisone. So one way or another, hopefully that's going to happen. If I do have issues with this biologic, then there are others that I can try, and there's also the potential option for me to move over to tablets. But again, with having a stoma, it's difficult because I don't absorb things in the same way that somebody else would. So just because there's a tablet option doesn't mean that will work for me. So we'll see what happens. I'm interested to see what information they get from the pharmacy about supplements, and I'm interested to give it all a go and see what happens. But at least we have a treatment plan, and at least I feel like I can move forwards now. Every biologic has side effects. Every biologic, it leaves the potential for infection, and it's not fun. Nobody wants to have to be on these drugs. At the end of the day, they're derivatives of chemotherapy. They're not nice at the end of the day, but we have to get the inflammation under control, and I can't keep living on prednisone, masking lots and lots of horrible symptoms. So hopefully this is going to work. That's all I can really say. Thank you so much to everybody for your support, for helping me throughout the whole process with me sharing this saga and what's been going on. I will definitely keep everybody up to date. And if you have any questions, or if you're in a similar situation and you want to bounce ideas or you want to ask a question, please go for it. I'm trying to be a really open book with everything. But yeah, that's where we are as of today. The sun is out, we have some forward movement, and hopefully this is the beginning of getting a better plan in place. So yeah, I'm feeling positive.